Many Australians don't realize just how big the healthcare sector really is. Australia now spends approximately 270.5 billion annually on healthcare. That over $10,000 per person every year. Healthcare now represents approximately 10.1% of Australia's entire economy. In reality, government funds roughly 70% of all healthcare spending together. So the federal government contributes over $106 billion at the moment on healthcare sector. And if you talk about while state and territory governments contribute $82 billion every year, healthcare spending now accounts for approximately 16.8% of all government expenditures as well. So in simple terms, nearly one out of every six government dollars goes towards healthcare. Hello everyone, welcome to Podcast Australia with another interesting topic, which is healthcare systems in Australia. And whether you have visited a GP, called an ambulance, gone to an emergency department, receive a Medicare rebate, you are part of this very huge massive system which is healthcare in Australia. And Australian healthcare model is often ranked among the best in the world. But how does it actually works? Have you ever think about it? How much does it cost and who pays for it? And of course, it continues to meet the needs of a growing and aging population in Australia. So today we will explore more about it, and the facts, the figures, the challenges, and of course what is the future of Australian healthcare is as well. So let's start together. And what is Australia's healthcare system actually works? Let's discuss about it. Australia operates what is known for a hybrid healthcare system. So this means healthcare is funded through both public healthcare and private healthcare, and the public healthcare system is supported primarily through Medicare provides Australians with access to public hospital treatment, subsidized GP visits, and of course for the specialist services, diagnostic testings, and various medical procedures. Alongside Medicare, Australians also have the option of purchasing private health insurances to gain access to private hospitals and reduce waiting times for certain procedures. This combination is often viewed internationally and of course as a balance between universal healthcare and private healthcare choices as well. So the size of Australian healthcare industry, if we discuss here, many Australians don't realize just how big the healthcare sector really is. Australia now spends approximately 270.5 billion annually on healthcare. That over $10,000 per person every year. Healthcare now represents approximately 10.1% of Australia's entire economy. And think about it for a moment that for every $100 generated here by the Australian economy, around $10 is spent on healthcare. So Australian government is basically spending a lot of money on health sector, and healthcare has become one of the Australia's largest industries and one of the biggest areas of government spending. And basically who pays for it? So if we discuss here who's paying for it and how does it work, we can explain you here that many people assume individually pay most healthcare costs. In reality, government funds roughly 70% of all healthcare spending together. So the federal government contributes over $106 billion at the moment on healthcare sector. And if you talk about while state and territory governments contribute $82 billion every year, healthcare spending now accounts for approximately 16.8% of all government expenditures as well. So in simple terms, nearly one out of every six government dollars goes towards healthcare. And why Medicare you think is very important? One reason Australians generally don't face massive hospital bills after emergencies is Medicare covering them. Imagine suffering heart attack or a serious incident or a medical emergency or a car accident. In many countries, these events could leave families with a huge hospital bills, but in Australian Medicare system significantly reduce the financial burden from a lot of Australians. And this one of the main reasons Australia's healthcare model continues to attract international attention. Hospitals is basically is the biggest cost at the moment for the governments as well, because Australia spends approximately 113.8 billion annually on hospitals alone. if we talk about Medicare. So this includes emergency departments, intensive care units, surgical services, and of course, specialist treatments and inpatient care. Hospitals are backbone in of Australian healthcare systems at the moment, yet demands continue to increase every single year. And if we discuss about emergency departments here, which is quite under pressure, if you go there, there's a long waiting times, which makes sense as well, because a lot of Australians are facing the waiting time period issues. And Australian public hospitals record approximately 8.8 million emergency department presentations every year. So that thousands of patients entering emergency departments every single day. Behind every visit are doctors involved, nurses, paramedics, specialists, administrative staffs, and they're working around the clock for them. And these numbers highlight both the strength and pressure of Australian hospital network at the moment. So Australians basically are living, if you talk about the ages here, so I can let you know, one of the Australians greatest healthcare success stories is life expectancy. So if we discuss your current figures below, so we can talk about a man usually lives in Australia around 81 years old, and women is 85 years. So Australia consistently ranked among the world healthiest developed nations, and a child born today can expect to live decade longer than Australians born in the early times. So because the healthcare systems are very good, so they're providing a good care to to their population as well. Now let's discuss about the aging population challenge Australia is currently facing as well. So living longer is wonderful, but it also major challenges happening as well, and it creates them because older Australians generally requires more medication, more hospital care, more aged care services, more specialist treatments. So Australia's population is basically aging rapidly. As the baby boomer generation enters retirement, healthcare demands is expected to continue rising for decades. So this is something is becoming a big issue in Australia at the moment. And if we talk about some other health challenges in Australia, so dementia is basically a growing national challenge in Australia. One health issue receiving increasingly attention is dementia. So currently around 425,000 Australians living is with dementia with this disease, and experts believe the figure could exceed 1 million Australians by 2065. So this will be a huge number for them to manage, and this could place enormous pressure on hospitals, of course, families, aged care facilities, and healthcare workers. It is one of the biggest long-term healthcare challenges Australia will be facing. And the other issue Australia is facing currently, which is the chronic diseases, and it includes basically a lot of different targets for Australians, and health challenges targets in Australia. So chronic disease is basically what is happening here is today healthcare system is spent much of its time managing long term conditions. Approximately 60% of Australians live with at least one chronic condition. So I can say diabetes, heart diseases, asthma, arthritis, and of course mental health conditions. So healthcare is no longer focused solely on treating illnesses. Increasingly it focuses on helping people, and of course managing conditions over many years. So yes, so these are the chronic conditions. We should try to ourselves to stay healthy so we don't get into this, especially diabetes. We need to try to go for walks, eating healthy, that help us to reduce the pressure on our hospitals and medical systems as well. Other thing is here, which is becoming a big issue according to the current research, is the heart diseases in Australia. So despite modern medications, cardiovascular diseases remains one of Australia's leading causes of death. So major risk factors include poor diet, smoking, physical inactivity, high blood pressure, or obesity. And this is why preventive healthcare measures has become such an important national focus at the moment. And we have a lot of support systems here related to heart diseases. Please get yourself checked. If you have any health concerns, please try to reduce all the other habits which can lead you to those heart diseases as well. And let's talk about the other health issues Australians are facing these days in Australia, which is impacting our healthcare system, is cancer survival rates. So Australia basically has some of the best cancer survival rates in the world, and because of the good success is there, driven by early detection programs here, which is running in by Australian governments, and public awareness campaigns, advanced treatment facilities, and access to specialists. Screening programs for breast cancer and bowel cancer continues to save thousands of Australians every year. So this is something is successfully is running, and if you have any health concerns, please consult your GPs, talk to a specialist, and get yourself checked. So this way you can save yourself and help the system to get remain strong and very much like ready for other patients who need more attention in this area. And let's talk about skin cancer here, which is an Australian reality. Like because of Australia's intense sunlight and UV exposures, around two-thirds of Australians will develop some sort of skin cancer during their lifetime. So Australia records some of the highest skin cancers and the rates on the earth. So that's why generation of Australians grew up imaging slip, slop, and slap. So slip on a shirt, slop on a sunscreen, and slap on a hat, and a simple message that saves thousands and countless lives that way. So don't forget to apply your sunscreen when you're leaving for home, or you're leaving for school, or you're leaving for work, or any other outside activity. Make sure you just put on some sort of sunscreen on yourself, then you go outside. So that way you can save yourself from all these skin cancer types as well. Now we discuss about one of the very major health issues in Australia people are facing, which is a mental health issues. Mental health is one of the Australians fastest growing healthcare priorities as well, which most Australians than ever are seeking support for anxiety, depression, burnout, workplace stress, and loneliness. And mental health treatments plans through GPs have become increasingly common, and this shift reflects growing awareness. The mental health is just as important as physical health. So you can go to your GP, your general physicians, discuss with them your mental health issues, and they can guide you, help you through, go through them, and they can help you to get to how to get to psychologists, how to get to psychiatrists, and they can help you with further treatments or therapies or medications, and you can save yourself from a lot of other health issues from that way, like further anxiety or depression, and it help you take you out from loneliness, and you can get back to normal life as soon as you can. So this is something I'm just thinking, like these are the mental health issues, or cancer health issues. You can save yourself if you take care of your health in a proper manner, and Australian government are investing heavily on those areas to keep people safe and healthy. Let's talk about telehealth revolution here as well. So one of the biggest healthcare transformations occurring during COVID-19, I must say, is telehealth rapidly expanding. And before COVID-19, we never seen telehealth in Australia. Doctors prefer us to come visit them physically, then they can prescribe medication, check us. But for a lot of different things now, we can access telehealth and save our times to to driving to doctors, and they can talk to you over the phone, or you can have a revisit them for your prescriptions or anything. So this is something you can definitely use. If you recently moved to Australia and you don't have access to that, you can definitely book your doctors online for definitely different medical centers, and you can access those doctors on telehealth care as well. So today Australians regularly access healthcare through you can do video consultations, telephone appointments, online prescriptions. So many Australians, especially in rural communities, healthcare is now available without even leaving home. So this is something you need to know about it, and you can get access by researching on Google, and you can get ideas from there, like which doctor you can see, and you can book online. Now we can discuss about some challenges for the rural healthcare challenges. So Australia is basically geographically enormous, as you know that, and many Australians live hundreds of kilometers from specialists, far from major hospitals in remote communities. So some patients basically travel entire days to receive treatment. This remains one of the Australia's biggest healthcare inequalities at the moment. Technology is helping, but challenges remain there as well. So this is the reality about the rural healthcare we are facing in Australia. The future of healthcare now discuss about, as we have a lot of podcasts previously about AI. So experts believe healthcare over the next decade will be transformed by technology. Expected growth areas include artificial intelligence, robotic surgeries, and smart wearables, and predictive around analytics or digital health records, remote patient monitoring. Doctor may increasingly use AI to assist diagnosis and identify diseases earlier than even before. So AI is coming into this fact area as well, so you can definitely do study about that as well, and you can definitely think about your career in that area as well, because AI is already introduced into the healthcare systems in Australia. And the healthcare systems basically in Australia, the healthcare system Australians use at the moment in 2040 could look like dramatically and different from the one we using it today. So we are expecting a good changes into this area because of AI is advanced implementation is going to be happening to the medical system in Australia as well. So now I'm trying to letting you guys know one thing. The point of doing this podcast is giving you some awareness about Australian healthcare systems. And my final thought on this topic is we're finishing with the statistics, say let's put it together everything into one perspective. Australia basically spends more than 270 billion every year on healthcare, and that's roughly 740 million every day, or 30 million dollar every hour, or more than $500,000 every minute being invested into keeping Australians healthy. So when you think about hospitals, ambulances, doctors, nurses, mental health services, medical research, aged care, or cancer treatments, you begin to understand that the scale of Australian healthcare system. And the real challenge for Australians over the next 20 years simply be funding healthcare. So it will be making healthcare more accessible, more efficient, and more sustainable as our population growth older, and and technology will be changes the way medicine is delivered. So Australia already has one of the best healthcare systems in the world, as I explained it to you according to my research and current data. And the question is that here, can we even make it better for our next generation? So how we can make our healthcare systems better for our next generation. And so think about it, stay healthy, eat healthy, and then that way you can live long and happy as well. So thanks for listening our podcast, Australia. If you enjoyed this session, don't forget to subscribe and share it with your friends and family and people around you, and let me know about your thoughts into a comment section. And let me know, would you prefer a healthcare system with lower cost or but longer waiting times, or faster treatments with higher personal costs? This is something I'm interested to know from you as well, and I'm really interested to hear your views about this. So in future podcasts, we are planning to get some of the medical professionals, and some of the doctors will be visiting us, and we having a podcast with them as well. Let us know about your thought about this as well, and if you have any questions, please send it to us. We will definitely prepare to ask them. Stay tuned, see you next time. Until stay blessed. Thanks.